Welcome back. We are putting a spotlight on brain health this morning. Medical professionals putting renewed spotlight on treating CTE and other traumatic brain injuries. Former NFL greats Tom Holmoe and Joe Herman recently participating in a 12-week study examining the effects of infrared light therapy on treating CTE. Researchers finding improvements across several measures of cognitive performance with no significant side effects from a chronic brain injury or trauma. A 2023 Boston University study found 345 former NFL players out of the 376 tested were diagnosed with CTE. Joining me now with more is Shepherd University Professor of Research, Dr. Ann Liebert. Dr. Liebert, great to have you. Thank you so much for being here.
Thanks very much for inviting me.
Yeah, and I want to talk really about brain health in general because I know Alzheimer's has become increasingly problematic, and our viewers care about dementia and aging and what the impact is on the brain. But tell us more about these treatments and results that you've seen in terms of improving overall brain health from your standpoint from dealing with sports figures.
So sports concussion can be leading into other long-term brain health issues, including long concussion, post-concussion syndrome, and eventually in a small amount of people, even if they have minor brain injuries over time, to something called chronic traumatic encephalopathy, which is inflammation of the brain. And the other thing that it can lead is Parkinson's disease, and we all remember Muhammad Ali and his amazing performance at the Olympics in terms of the effects of repeated concussions. But we have a new treatment which has been increasingly validated that will be able to not only treat these symptoms, but also, we think, to be able to prevent it.
You're talking about infrared light?
Yes, infrared
Tell me about
light.
Infrared light, because I use a sauna often, and it has infrared light in it. And I'm always wondering how specifically infrared light impacts a person.
So infrared light can be sauna, or we can have red light therapy, which is another red light LED. So photobiomodulation, or PBM as we call it for short, is a very specific wavelength of dose and energy that is different for different applications. And we use this specifically to energise the cells and to supercharge our battery, which is our mitochondria. And it's a specific treatment that we utilise within very narrow wavelengths, which is different from the sauna.
So do you recommend red light therapy then for brain health?
Yes, definitely recommend for general brain health and wellness, but also specifically if we have some injury, concussion or musculoskeletal injury, we can use specific wavelengths to treat. And now we're finding out from the University of Utah and our work at Shepherd University in concussion that we can also perhaps prevent this happening in the long term, especially with younger people who might be at school or college. And this is the exciting part of infrared therapy.
Wow, that's incredible. That is big information there. What have you learned about brain health in general over your studies?
So brain health in general depends on the energetics of the body. So as we age, we have a slowdown in our metabolism, but that doesn't mean that we have cognitive issues. So what happens if there's some sort of assault like concussion or viruses or other different areas that can accelerate this aging process, decrease our energy and produce a problem with our brain health. So what we want to do is, before that process starts, especially with aging and other cognitive issues, we want to be able to start some treatment that will be preventatively and neuroprotective on these conditions.
How often should one be using red light therapy?
So red light therapy, generally for once or twice a week if we're doing it for wellness or pain or other conditions. If we have a specific injury or concussion injury, we should be using it intensively for 3 times a week for the period of time it takes to recover. If we have already got a brain health issue, we probably need to do the treatment 2 to 3 times a week. Probably ongoing, and we target both the head, and because of the gut-brain axis, we also target the abdomen, and this seems to be the most effective way to treat.
And when you treat with red light therapy, what does that look like in a practical way? Is that like above you? Are you putting a mask on? Where's the red light therapy coming from?
Specifically for these instances in concussion and post-concussion and CTE, we use a helmet that's directly on the skull.
I see.
The light goes in about 2 or 3 centimetres into the head because of all of our skin and our hair cells actually absorb the light.
Yeah.
But when we're using it on the gut for the gut-brain axis, we have to use laser treatment. So infrared laser, cold laser, no noticeable side effects in the last 70 years of its use. And we use specific wavelengths of infrared laser to treat deeper areas.
That's really fascinating. And is there any impact to the hair when you're using the red light therapy on your head?
That's very interesting because this came out of 1967. A doctor in Hungary incidentally was working on cancer treatment. The infrared treatment had no effect on the cancer cells, but what he noticed was all the wounds healed quickly and all the hair grow back. And interestingly, NASA, during the 1980s in the Space Shuttle program, noticed without gravity that all of the wounds were healing while they were tending the plants.
No, because I asked because some people wear a cap in the sauna to protect their hair because of the red light therapy. How long should one use red light therapy? You said a couple of times a week, but how long each session?
So each session would be about 20 minutes. If you're doing specific medical grade laser treatment, it happens for about 2 or 3 minutes at large doses of very cold laser, so no heat at all.
No heat.
So laser is very quick. Red light therapy using LED is about 20 minutes.
Well, really fascinating stuff. Dr. Liebert, thank you very much for this information.
Thank you very much for having me on.
We appreciate you,
Thank you.
Dr. Ann Liebert.